Good morning, everyone. It's nice to see a full house here in the off session. I'd like to call the Tuesday, September 24th, 2024 committee meeting of the Legislative Regulation Review Committee to order. It is 11:02. Would my co-chair like to make any remarks before we begin?
Just delighted to be here. And again, echoing my co-chair, it's great to see so many folks here in attendance. And I very much appreciate every department and throughout the state government to have folks here watching our proceedings. Thank you.
Great. Thank you so much. Would the ranking members, would you like to add anything? Nope. I see a head shake from one. Oh, from both of them. Great. So let's get down to business. Madam Administrator, would you please make the quorum call for us?
Representative Dathan,
Present.
Senator Kissel, Representative Carpino,
Present.
Senator Maroney,
Present.
Representative Claridis Detria,
Present.
Representative Arnone, Representative Godfrey,
Here.
Senator Hartley, Senator Kelly,
Senator Kelly's here.
Representative McWherty.
Present.
One more time for video.
Present.
Thank you. Senator Austin, Representative Ryan,
Here.
Representative Fishbein, Senator Ciccarella.
Senator Ciccarella's here.
Thank you. We're all set.
Great. Thank you so much. With that, let's begin today's business. The first item on the agenda is the proposed regulation 2024-18 from the Office of Early Childhood, Child Care Centers, and Child Care Group Homes. I'd like to entertain a motion to accept the LCO recommendation of approval in whole with technical corrections and substitute pages.
So moved.
Second.
Great. Moved by my good co-chair and seconded by Representative Godfrey. Is there any discussion? Okay, great. Sure, I can go first. I have a couple questions for the Office of Early Childhood, if you have a few minutes.
Good morning, Representative Dathan. I'm going to have my Director of Child Care Licensing. I'll also ask my legal director to come up as they've been working on these. Happy to answer your questions.
I know who you are, Madam Commissioner, but could you please state your name and for the record?
Yes, my name is Beth Bai. I'm Commissioner of the Office of Early Childhood.
Great, thank you. And everyone who speaks, if you can introduce yourself before we get going. Madam Commissioner, can you please explain the ratio change that is in this proposed regulation?
Sure. There are two ratio changes in these regulations, and also a sort of finalization of a statutory change that happened in 2019. So in 2019, the legislature passed a statute that allowed children who were 2 years and 9 months to enter a preschool classroom, even if it wasn't in September that they were 2 years and 9 months. And these regulations basically solidify that the parents need to sign authorization for a child of 2 years and 9 months to enter a preschool classroom. So that's here. The other change is that school age ratios, which were 1 to 10, changed to 1 to 15. Which is a significant change, but we think in line with what happens all day in schools, which is kids are in groups of 20 to 30 most of the day with one adult. And this will help a lot with the shortage of after-school care. And then the ratio for 2-year-olds. So sometimes 2-year-olds are toddlers, but toddlers really start at the age of 13, 14 months through 3 years. But the ratio will be 1 to 4 in these regs. It has to be passed, but 1 to 4 from infancy through 2 years. And then from 2 years until 2 years and 9 months, it would move to 1 to 5. And then at 2 years and 9 months, it will comport with the statutory change that's sort of finalized in these regulations and go to 1 to 10.
Got it. With these ratio changes, are these in line with other states? Where does Connecticut currently lie? And under these proposed regulations, what would the changes be?
Yes, I can give you other states and their toddler ratios, which again, I've said, like in some states at 14 months, the number changes. We're saying not until 2 years, but if we count 2-year-olds as toddlers, which is the way people assign the regulations, we have at 4 to 1, there are 11 states. At 5 to 1, there are 12 states. At 6 to 1, there are 13 states. And 24 states are over 6 to 1, have more than 6 to 1 for the ratio.
So more than 6 to 1 for 2 to 2 years and 9 months. Are you
For
aware?
toddlers, so it could be, again, the states all define toddlers differently. In general, a toddler starts about 14 months. So I'm sorry, just want to try to be exact.
No, that's really helpful. Are you aware of any states that have had issues with increased ratio sizes mostly for public health concerns? Because some of the comments that folks had were relating to public health and sanitary conditions.
I appreciate that question. We did reach out to the association that oversees licensing, and I'm going to ask Liz. Liz, I think Kansas just passed some changes, and I'm not seeing it in my notes, but I think it's in a different note that you may have over there.
Sure, I can address that. Thank you.
Can you please introduce yourself for us?
Of
Thank you.
course. My name is Liz Proietti. I'm the director of the licensing division at the Office of Early Childhood. We do have some information about illnesses or injuries that are reported by other states. We know that Kansas just recently increased their ratio for 2-year-olds from 1 to 5 to 1 to 6. That's a relatively recent change, so there's not really good data on that yet. However, the ratio was previously 1 to 5. We also, it's really hard to tell. It's really hard to compare states. Our state currently defines or requires that programs report injuries that result in hospitalization of a child. These regulations will expand that definition so that programs will have to report not only hospitalizations, but also concussions, fractures, and second and third degree burns. And so some states already do report those types of numbers. We're just not comparing necessarily the same things right now.
One thing we can probably share with the committee is we did find a meta-analysis. So because all the states define it so differently, there was a study that sort of tried to, in a meta-analysis, they tried to take every study done and put them together to get more reliability and validity because of the complexity. And this was a while ago. This was in 2017. But comparing the states, it does say, and by the way, I was a toddler teacher. I believe in keeping these ratios 1 to 4, 1 to 5. But the empirical evidence to date about the benefits for child outcomes of small class sizes and low teacher-child ratios in early childhood classrooms has been mixed and largely non-conclusive. I think, you can talk to people who do the work. It's hard work. I would never want to go to 1 to 6. I think this is 1 to 5 for a very short period of time. And we, in Connecticut, we also do annual inspections, and that's, I don't know, how many states do inspections every year of every program, Liz? Do you know that data?
I'm not certain, but my guess is that all states are required.
Because of ACF, yeah. So there's an inspection every year as well of all the all the sites. So, you know, it's hard to know. The states that have increased have not, it's not like there's been reports from our federal agency that there have been big changes, but I think we still want to keep among the best ratios in the country. The only one lower than us for infants and toddlers is Massachusetts, which I believe is 1 to 3.5. So you could have 7 children and 2 teachers, not a half a child.
Yeah, I had 2 kids in diapers and 3 under the age of 4 for a few months, and it was a challenge. So I couldn't imagine having another one in the mix. Couple more questions.
Sure.
Does the American Pediatric Association have any sort of comments on ratio sizes?
Yes, we did receive comments related to this from the Academy of Pediatrics and keep it at 4 to 1.
Okay, thank you. And then my last question has to do with waiting list. Does the agency have a breakdown of waiting list for each sort of age gap that you spoke about earlier? If you could share that with the committee, what the wait list is.
We don't have waiting lists, but we do know supply and demand in every town, and it's a little bit complicated to figure out because there are families who are not going to send their children to a center or even a family childcare home. They patch it together, et cetera. So we've been able to use some data from the Bipartisan Policy Center and look at our towns and the birth rates. And we have every town's shortage of infant toddler care, but across the state, the current capacity for the need for infant toddler care, taking out those kids who we assume from national data are not going to ever use childcare, we have about 35% of the supply that we need. So there's a 65% shortage. And if I compare that to 3 and 4-year-olds, we are at 100% of our supply. So if you do the same exercise with 3 and 4-year-olds, we are at supply. They're not all in the right place. There's still a lot of problems with access to preschool in some of our highest need communities. But the shortage of infant toddler care is really impacting our economy. And if parents can't get their child in the center, then they are using unregulated care. So we're concerned about that. We see this as a slight, very slight change for 9 months, a 20% change for 9 months, that then's going to be 100% change at 2 years and 9 months to 10 to 1. To try to make safe licensed care available to more families.
Yeah, I agree that we need to have good quality programs for our youngest residents. I'm going to pass to my co-chair who has a couple more
Sure.
questions.
Thank you very much, Chairman Dathan. Commissioner Bai, it is great as always to see you. I love seeing former Senate colleagues in positions of authority helping to run our state of Connecticut. And I hear in your testimony that, you know, this is a difficult decision. This was something that you did professionally for a number of years. And in a perfect world, we'd have perfect ratios. And everybody would be more than happy. But we don't live in a perfect world. And we have a saying in the Senate, I'm sure they have it in the House as well, that we don't want the perfect to be the enemy of the good. And so the first point I want to highlight and also put on the record that you were gracious enough with your staff to have Zoom meetings with myself and my co-chair twice prior to this meeting to try to hash out some of the concerns that we had. And I appreciate that very, very much. But even though in this regulation, there will be a change of ratio, and as you stated, for a very narrow window of time, there's also another factor that folks may not be aware of, and that's regulations regarding square footage of the facilities itself and the classrooms. And so in our conversations, you brought to our attention that a lot of these facilities still will have to maintain the current ratios, even with the ratio change, because of the size of their facility and not easily able to change that. Is that a fair statement of fact?
Yes, I believe that's a fair statement of fact, that facilities are built given the 35 square feet per child. And I would say this is particularly true for facilities that were custom built, like some of the chains, they custom build their buildings and they are going to have a harder time because their classrooms are built with the square footage to 8 to maximize the profit. Some of the for-profit ones will have actually the harder time here. There are a whole lot of centers, probably Liz and I were tossing this around, at least over half, more than half, to use proper early childhood language. We like to use our math words right in early childhood, but more than half are in church basements, are in spaces where they may be able, the more informal nonprofits tend to be in what we call leftover spaces. Over time, I hope we have the best facilities in the world, but right now they're in leftover spaces, and some of them will be more able to take advantage of this change. I also want to make one other point, Senator Kissel, that's a little different than what you asked, but it's really important. Bigger problem than ratios is workforce. We are short infant toddler spaces because of workforce more than because of this ratio change. This is an incremental help and is super important because anything helps. But centers have said to us, those particularly centers in high need communities where it's really hard to hire staff, that this 5-to-1 will help them at the beginning of the day and the end of the day. I see Senator Austin is here. We had a program in Eastern Connecticut that for a couple of years had to close at 4:30 because they didn't have enough staff to cover the whole day. This slight change will help because when we go in on a visit, it's not like you can say, oh, the teacher was in the bathroom, we weren't at 4-to-1. They have to meet 4-to-1 every minute of the day. So I think this will help with workforce in that on the ends of the days, naps and nap time, et cetera, it opens up the ability to have one more child. Even if the classroom's made for 8, at the end of the day, they're only, 3 or 4 usually after, say, 5 to 6, depending on how it goes. So we really heard from programs that it would help them with the workforce, which is something that we're not thinking of, but as a former director, those ends of the day are the times I was in the classroom.
And those are excellent points. And actually, that's impacting every segment of our society as the baby boomers age out, as much as they still want to contribute to society and take on volunteer roles and part-time positions. Still, businesses across the board are facing shortages of people even wanting to apply, let alone whom they eventually hire. And in the early education area, it's even more perplexing and difficult because on the one hand, we want to increase qualifications, and yet compensation doesn't really parallel that. And so as people face the dilemma of where do they want to get their education and what do they want to pursue as a career, as appealing as it is to want to work with this age group, just between the training and the remuneration, it just may become prohibitive for people. And so that is a tricky tightrope that we have to walk. The other thing is that, again, along the lines of we don't want the perfect to be the enemy of the good. And you had stated in your answers to Chairman Dathan, that if we don't move along in this direction, as much as it may not be the optimal, in some people's opinion, although the jury's still out on the ultimate far-reaching consequences. And again, as you pointed out, by the time the child reaches 2, things get in another direction already. So it's a very narrow period of months. But I believe that Governor Lamont has a concern that if we have lots of people that just can't even get any kind of care, that the default is something that is not even within the purview of the state of Connecticut. And so, it's better to have facilities and folks available, although it may not be the perfect world, than something where they say, sorry, the waiting list is like years and years long, and by that time your child will be too old in any event. So would it be fair to state that you have discussed this issue, this dilemma, with Governor Lamont, and that he's fully supportive of this change?
Yes, this change is important to Governor Lamont because he recognizes that childcare is critical for our state's economy and for children's healthy development. And so he has been asking these questions for 4 years, like, where can we get to? And I think we got to the right balance, over a couple of years talking with Governor Lamont with this 1 to 5, that we're safeguarding children's safety, but we're also helping more families be able to enter the workforce and make a living themselves and be able to put their child in a program that's licensed, not scattered with neighbors one day, a grandparent another day. Children's brains require structure and routine, which licensed childcare providers provide.
And probably not a question, but more of a statement. And I'm going to support the regulations this morning. And I've received emails on both sides of this issue. A lot of them, Democrats, Republicans. It's not really a partisan issue. It doesn't fall along those lines. I have people that I greatly admire and respect on various local boards of education who have said, vote no, vote no, vote no. And then I've had other people in the business community saying, vote yes, vote yes, vote yes, and everything in between. And they all have good rationales behind their positions. In this particular instance, though, I do want to highlight for my colleagues on the committee, one of the key points that I'm going to rely on. The Education Committee, where the statutory authority for you to promulgate these proposed regulations rested. And I thought it may have come out of Children's, and I was corrected. Thank you to our crack LCO team for setting me straight on that and all the hard work they did on the revisions. And there was a lot of pages with technical corrections. So thank you, LCO staff, so much. Katrina in particular, get a shout out. I don't hesitate to oppose a regulation if I think it goes beyond the scope of what was granted an authority legislatively. But in this particular instance, when I drilled down deep, it seemed to me that it was pretty apparent that the Education Committee, where this all bubbled up from, really examined this issue, and that they made a conscious decision as the Committee of Cognizance to devolve the authority to determine these ratios to you, Commissioner. And we as a legislature voted for that. And so, yeah, if there was something where a commissioner of a different department was, in my view, exceeding their authority, or it was a real gray area, or we didn't anticipate that they were going to go left and we were going to go right, or vice versa, then I'd be not hesitant whatsoever to say no. But this is an area where we as a legislature grappled with it, at least the Committee of Cognizance, and I don't feel that they felt really either strong enough one way or another, or they felt that the state would be best served and the people of Connecticut would be best served if this particular ratio issue was turned over to you as commissioner with your crack staff to really analyze what's going on throughout the other states, break it down, bounce it off Governor Lamont, see where you settled on, and reach this determination. And so I have that level of comfort that I may not always have. But in this particular instance, between your kind and gracious outreach to this committee and your discussions and your willingness to work with us, I feel comfortable that I can support this proposed regulation at this time. And I thank you all for your work with the committee. Thank you, Madam Chair.
Thank you.
Thank you, Co-Chair. I echo your sentiments, and I do want to reiterate for folks at home that as part of the whole regulation process, it does go in front of LCO, a nonpartisan office, and it also does go to the Attorney General to ensure that the commissioners or the agencies have their authority to make such regulations. And I did want to echo that while this regulation talks about a 2019 law, in 2024, we actually did a Public Act 24-78 where this was part of your authority to do this anyway. So if for folks that are trying to understand that, just wanted to kind of reiterate that. Is there any other comments? Senator Austin.
Thank you very much. So I'm going to go back to some questions.
Sure.
And one of the questions that I didn't really hear an answer on was relative to the number of slots that will open up if we adopt these regulations. I hear sort of a statement will open up more slots, but there has to be a way to calculate what that means.
Yeah, I did some calculations, and you're welcome to challenge them, Senator, if you want to take it further. But We have about 30,000 spaces in the state for infants and toddlers. So
And those are all in regulated daycares.
regulated centers. These are
Centers.
center regs. So we
Yep.
have more in family childcare. So if we say a third are 0 to 1, a third are 1 to 2, a third are 2 to 3. So that leaves about 10,000 2-year-olds in licensed care. And this would be a 20% increase in spaces if every program did it. But we've just said that the facilities can't always do it. Some programs don't want to do it. They think 4 to 1 is right. There's nothing about this that is mandatory. So if a third of the center said, we're going to go to 5 to 1 because they have the space, because they believe they can make it work with 2-year-olds, that would create around 650 to 700 spaces. If half of the programs adopted this change, that would get to 1,000. Now, we were able to open up more spaces with the 2 years and 9 months becoming preschool, because those children could then move up to preschool. It created more space. I didn't calculate that. But so we're saying somewhere between 650 and 1,000 added infant toddler spaces.
Thank you. And so I want to delve into that a little bit
Sure.
more. So we did a budget that talked about an increase in the biennial budget. We talked about increasing wages for childcare workers that are in care for kids.
Mhm.
And we said we're going to increase the wages, so we put more money in the budget. And the implication was there was going to be some increases in spots for childcare, but in actual fact, we didn't put in as much that that would cover the total increase on salaries. And so we saw a decrease in spots available for children in care for kids instead of an increase in spots available. When Representative Walker and I looked at this, that was the analysis that came out of that particular piece of the budget. And so my fear is that we're looking at this again and we're talking about an increase in spots, but I'm not positive that there's anything that shows that there will be an increase in spots available for this group of parents with children of this age or children in this age group.
Thank you for that question, Senator Austin. Governor Lamont just asked me, how are we doing on infant toddler care? Because you all voted to increase by 1,300 the state funded spaces. We've increased care for kids rates 11% a year, and now we're entering our 3rd year of that. And there's also market demand, which I just talked about,
Right.
waiting lists and demand. So programs are shifting preschool spaces over to be infant toddler spaces. So I just had to get some numbers ready for him. Infant toddler capacity in 2019 was 25,000 infant and toddlers. And
In what year? I'm sorry.
in January of 2019, to be specific. And then in January of 2024, our licensed capacity for infants and toddlers is up to 30,000. So both the market demand, the investments, the care for kids rates, our infant toddler rates went from, because of the legislature, from 9,000 a child to 13,500 a child. And for the first time ever, we added family childcare to our state-funded system, which has been very stabilizing for those programs, but we're not funding enough of them. So we
And
have.
I'm sorry, I just
Go
want to
ahead.
make sure that, because we're not talking about 9,000 children, we're talking about, we used to pay 9,000.
We used to pay
And now we're
$9,000.
paying 13,500. I want to make sure that people
Yeah,
understand
thank
that
you.
that's what we're talking
But
about.
those, what I'm saying is the combination of factors plus the 2 years, 9 months, plus the family childcare change where they can go up to 9 now with the second staff person. This legislature's done a lot of things to address this problem. Now, the preschool supply is down because there's a shift, but our biggest problem was infant toddler supply, and that the governor in his proposal a few years ago said, we're going to focus here. And so he asked me, how are we doing? And I can share that chart with the committee that shows over time. For
That
the
would be
first
helpful.
time in decades, we've seen an uptick in infant toddler spaces.
And again, looking at this sort of broadly as an issue, these regulations really, the 2024 piece of legislation, is that incorporated into this? Or are we going to see other regulations that come out as a result of that 2024? Because we don't move that fast
Yeah.
on regulation. So I just want
Well,
to make sure
Let me
that.
just say, I thank you for that question because I think the public is watching and saying, what did the education committee do and how did
Right.
I get authority? Because, you know, childcare is critical infrastructure for our state. And because the regulatory process is very long. And in fact, like when the after school advocates came in and said, we want to change this ratio, you know, that led to us having to go back out to public comment, back to new regs, back to the AG, you know, so it's been, I think it was in my first 2 months as commissioner, I signed off on this process.
Yep.
It takes a very long time. We just asked for very limited authority by the legislature because school was starting, because we had the change in the kindergarten age. So the after school stuff for 4 and 5-year-olds became, you know, I heard from the board of Ed and Senator Lesser in Middletown to say, if this doesn't change, we can't offer this for pre-K program. So we said to the legislature, give us authority until it passes regs review, because we felt that way we're still giving your committee the respect it deserves and the process is proper. But we asked for temporary because of the timing and the urgency for programs, particularly after school programs.
So the 24 statute just gives you temporary authority, and since this is based on a statute that was passed in 2019, in 4 or 5 years, we will deal with a permanent resolution. So it gives us another bite at the apple, so to speak, should we find that this is not providing quality childcare.
I would say that I'm trying to process this. What was passed in 2019 basically overrode the regulations to say 2 years and 9 months. Now, we want to put that in the regulations because it's better suited. It gets very confusing for programs. There's a statutory change, there's a regulatory change. So we will start this process again, probably in a couple of years, to change. The other thing, because I just said it happened, this legislature always has a statutory authority to do what they did with 2 years and 9 months, to say, this isn't working, we're going to do statutory change, and then it would be fixed again when the regs come around again.
Or we could do what we did in that one and say, we're saying these are not working. for us,
Exactly.
And we want to temporarily cease the changes that we made here today. If this regulation passes, we could go back and say, hey, listen, this isn't working. We're getting problems that are being talked about in centers across the state.
Yes.
And so that's another one of my questions is, I think I've asked you at every single meeting that you have come to in front of appropriations about the childcare desert that's in Eastern Connecticut. And I know that the state broadly has childcare limitations, but Eastern Connecticut has long been identified as one of those spots that does not have the care necessary to provide people with childcare and going to work. And most of our jobs are in-person jobs. They're working in tourism, or they're working at the 2 tribal nations, or they're working at Electric Boat. And I haven't yet figured out how to do welding from home. So does this in any way increase the number of slots available in Eastern Connecticut? Because we already have a shortage of centers. So have you looked at the geographical changes when you talk about the 680 some slots?
Some of it, Senator Austin, and I appreciate the question, some of it will depend on the space configuration of the centers that exist in Eastern Connecticut, but I do know there have been workforce issues on the ends of the day, so I believe it will improve that. I just want to go over sort of what's happening in Eastern Connecticut, because you're right, it's a big problem. The governor has said focus here. This legislature passed TriShare this year. We are working with LRRC and CBIA and Electric Boat to launch TriShare with Electric Boat specifically, which the state pays a third, and this is going to be a pilot. The parent pays a third, and the business pays a third, and Electric Boat has put up $500,000 for that. We've also applied for a federal grant. We'll hear in the next 2 weeks, and a significant amount of those resources were for Eastern Connecticut. We have grants. We've asked for grants to open family childcare homes specifically in Eastern Connecticut. We also have 4 to 5 incubators planned, funding for 4 to 5 incubators planned in our preschool development grant. And we brought together TVCCA with the Mohegan tribe, because there is a 300-child childcare center sitting empty.
Yep.
And they're anxious to have it be a community resource. And TVCCA is interested in being, they need a partner, and they had a for-profit partner before that was costing them a lot of money. And so we have brought them together now 3 times, and we anticipate that program opening as well, which will be a big help. So there's very specific efforts in Eastern Connecticut that aren't happening in other parts of the state. And you have asked me, and we haven't made as much progress. Even when we went out we had new spaces, we went out to Eastern Connecticut, but the providers weren't there to apply for those spaces, which is why we think we need to actively fund with grants family childcare homes for a year so they can get up and going and profitable. The same with, we're going to have state resources with this 300-child center and a nonprofit provider where it will work for the tribe. So we're doing some active efforts. This will help the centers in your region to the extent that they have the space and the want to do that.
So, and I appreciate that. And I looked at the TriShare and I was a little concerned. I appreciate having a pilot, but the only business in the state that is participating in TriShare right now is Electric Boat. That I know of. When I look at this, they're the only one in the whole state. So we're not requiring the same sort of activity to happen in other parts of the state. We are taking a part of the state which has primarily in-person jobs.
Mhm.
That's what we have, our
Mhm.
in-person, blue collar, retail, tourism kinds of jobs. And you can't have somebody working in a gaming institution from home, and you can't have somebody working in the yard at Electric Boat, both very important businesses in Eastern Connecticut. And, I'm hoping that we can do something with the site at Mohegan. I was talking to them yesterday about some other things, but I think that, I am hesitant to make a complete decision here today. I'm without seeing the end result on some things. I'm listening to everything you're saying here today. I appreciate the concern that people have, but I, like Senator Kissel, have had people to tell me, vote no, this is not good for kids. This is going to hurt kids. It's going to hurt workers. Workers are not going to be able to handle this. I've had people on the other side say the same thing. This is something I need a place for my child to go. And I feel that the weighing of both of these is not something easy to do. And, I will, should I vote to support this, I will be asking for data to show that this is not hurting either workers or children. And I would strongly suggest that OEC, Office of Early Childhood, because we all know what OEC stands for, nobody out there does, and, you know, that you start collecting that data right away, because we could turn this around
Mhm.
in the next legislative session.
Mhm.
And that is something that I think that people need to know, that we could do this on a pilot basis, like we are doing TriShare on a pilot basis. And Electric Boat wants this because they desperately need places for children to go. All you have to do is ask them how many families are there in their workforce and how many of those families are having children between the ages of 0 to 5. You can get those numbers very easily. It's what Electric Boat brings to the table, with exact numbers on how many children are being born in their workforce. Their workforce is significantly younger than it used to be.
Mhm.
They're of childbearing age, and they want to have a safe, clean, quality care place for their children to go to, although I think some of them would like to see second shift childcare, because EB runs 24 hours a day. Same thing with the tribal nations.
Mhm.
So I'll sit and listen to where we are. I don't know if anybody else has any other questions, but that's where I am right now. I'm concerned about this. And I have people that work in the childcare arena, and they're concerned about this. And I also have some very big businesses that are saying, we really need help here in Eastern Connecticut. And so I'm hoping you're not putting all the pilots on the back of Eastern Connecticut. You know, so that's my concern right now. Thank you. Thank you, Madam Chair.
Senator, if I may, just one point I want to make. Another part of these regulations will make it much easier for us to collect data, because we're clearly operationally defining and making programs report in a clear way on illness or injury. So we will have those available upon request, and you know, our committee of cognizance could ask us to report regularly, but we will do that.
I appreciate that, that we're doing that. I am, you know, I am also concerned that sometimes on regulations review, we are faced with a choice that I don't think always that the regulations are going above and beyond what the original regulation was. And that seems to be a habit and a pattern lately in regs review, that we are seeing regulations come to us. You know, the fact that the 24 regs say you can do this temporarily, but the term temporarily does not fit into the regulations here today. We can say it fits because we can go back to the legislature and change whatever we so choose. But I am very cognizant of the fact that we appear to be making changes in regs review that have not been fully vetted by the legislature. And in this legislature, we have decided that that's an important component of our regulations. Thank you.
Thank you very much, Senator. Some excellent points that you raised. And that was one of the issues. The data collection as part of this regulation is really builds up from what we normally get. So we'll be able to follow this issue very closely as this expands. I have one more question, if I may, and I'm just going to open it up also to other members of the committee, because I know many of us have received comments on both sides of the issue, from childcare providers, from parents, from healthcare professionals. In terms of the data collected, is that sort of standard for what, can you just run through that again, so that folks understand
Sure.
where we are currently with the data that we get from our providers and what this regulation proposes?
Yes, I'll give you what this proposes, and then I'll have Liz speak to prior. So basically, these regulations require that the program shall maintain written reports of any injuries that result in an injury or illness of a child, and whether the child was transported to the ER or other medical facility as a result of the illness or injury, and incidents that are required to be reported to DCF. The operator shall notify OEC by the next business day of any injury, death of a child that results in fracture, second or third degree burn, concussion, or any admission to the hospital. But Liz, I know that came from comments and also licensings trying to get their hands around how do we make sure we're getting these reports. So do you want to speak to prior and then the chain?
Sure. So I believe that this change to the regulation also stems from a public act that required us to develop these regulations that would, make programs report concussions, fractures, second and third degree burns. Currently, they only have to report admissions to the hospital. And so that will be a significant change. And we will certainly do investigations of those to make sure that, sometimes those injuries are accidents, pure accidents, but sometimes there are other things that go along with that. So we will certainly follow up with investigating those thoroughly.
Great. Thank you very much. Any other questions from committee members? Seeing none, Madam Administrator, would you please call the roll?
For proposed regulation 2024-018 from the Office of Early Childhood regarding child care centers and child care group homes, we're entertaining a motion to accept the LCO recommendation of approval in whole with technical corrections and substitute pages. Representative Dathan.
Yes.
Senator Kissel. Representative Carpino.
Yes.
Senator Maroney.
Yes.
Representative Arnone. Senator Ciccarella.
Senator Ciccarella votes yes.
Representative Fishbein. Representative Godfrey.
Representative Godfrey votes yes.
Senator Hartley. Senator Kelly.
Senator Kelly votes yes.
Representative Claire DeStitria.
Representative Claire DeStitria votes yes.
Representative McGordy.
Representative McGordy votes yes.
Senator Austin.
Senator Austin will vote in the affirmative, but we'll be watching the activity that happens in our child care centers.
Representative Ryan.
Representative Ryan votes yes.
Thank you.
Thank you very much, Madam Administrator. We're going to hold the votes open as a reminder in case any other legislators have an opportunity to jump on. Next, we are going to have the proposed regulation 24-19 from the Department of Labor, representatives of employers and employees. I would entertain a motion to accept the LCO recommendation of approval in whole with technical corrections.
So moved. Second.
Excellent. Thank you very much, Senator Kissel, for your and second by Representative Godfrey. With that, is there any discussion? Seeing none, Madam Administrator, could you please call the roll?
For proposed regulation 2024-019 from the Department of Labor regarding representatives of employers and employees, we're entertaining a motion to approve the LCO recommendation of approval in whole with technical corrections. Representative Dathan.
Yes.
Senator Kissel. Representative Carpino.
Yes.
Senator Maroney.
Yes.
Representative Arnone. Senator Ciccarella.
Senator Ciccarella votes yes.
Representative Fishbein. Representative Godfrey.
And Representative Godfrey votes yes.
Senator Hartley. Senator Kelly.
Senator Kelly votes yes.
Representative Claire DeStitria.
Representative Claire DeStitria votes yes.
One more time for video, please.
Representative Claire DeStitria votes yes.
Thank you. Representative McGordy.
Representative McGordy votes yes.
Senator Austin.
Senator Austin votes in the affirmative.
Representative Ryan.
Representative Ryan votes yes.
Thank you.
Great. Thank you very much. Again, we're going to hold the votes open. Finally, we have the proposed regulation 2024-17A from the Department of Energy and Environmental Protection, use, control, and possessing of ionized radiation. I would entertain a motion to accept the LCO recommendation of approval in whole with technical corrections.
So move.
Second.
We got the tag team here. My co-chair and Representative Godfrey seconds it. Is there any discussion? Seeing none, Madam Administrator, would you please call the roll?
For proposed regulation 2024-017A from the Department of Energy and Environmental Protection regarding use, control, and possession of ionizing radiation, we are voting on a motion to, we're entertaining a motion to accept the LCO recommendation of approval in whole with technical corrections. Representative Dathan. Senator Kissel. Representative Carpino.
Yes.
Senator Maroney.
Yes.
Representative Arnone. Senator Ciccarella.
Senator Ciccarella votes yes.
Representative Fishbein. Representative Godfrey.
Representative Godfrey votes yes.
Senator Hartley. Senator Kelly.
Senator Kelly votes yes.
Representative Claridis Detria.
Yes.
One more time for video, please.
Representative Claridis Detria votes yes.
Thank you. Representative McGordy.
Representative McGordy votes yes.
Senator Austin.
Senator Austin votes in the affirmative.
Representative Ryan. Representative Ryan.
Representative Ryan votes yes.
Thank you.
Great. Thank you very much. Madam Administrator, is there anyone who's missing votes? Because our agenda is concluded.
No one's missing votes.
Wonderful. Well, thank you everyone for attending today. And I hope you have a lovely rest of the month of September as we get into one of my favorite seasons of the year and seeing the beautiful foliage that Connecticut has to offer. Would my co-chair like to make any closing remarks?
See everyone in October and happy campaigning if you're running for election.
Of course. Good luck to everyone. My ranking members, do you have anything to add? I'm seeing head shakes, so I think we're good. Thank you so much. And with that, I'll entertain a motion to adjourn.
So move.
So move. Second.
Moved and seconded. All in favor?
Aye.
Aye. Thank you so much, everyone, for your patience today.